Well, we have three basic pillars of infection control. One is what we call hand hygiene, and it may just be, often simplistic to say, wash your hands before touching a patient. But actually, we monitor this very carefully in the hospital, and hand hygiene or washing hands is simple, inexpensive, but it's one of the best things we can do in terms of preventing infections in the hospital or spreading infections from patient to patient. Also, we're very attuned to environmental cleaning in the hospital to make sure that between procedures or if a patient leaves his room or whatever, that we're cleaning all the surfaces so that any infection there did not spread to other people. And then the third pillar of infection control is what we call antibiotic stewardship. It's pretty well known that antibiotics are overused in the United States. It's estimated that 30 to 50% of all antibiotics given are given inappropriately, which means that oftentimes you may have just a viral infection, go to a doctor and say, I need an antibiotic because an antibiotic helped me last time. And if you get antibiotics and there's an overuse of antibiotics, then we tend to develop very resistant organisms that are resistant to all the antibiotics that patients are getting. And that's a big problem in infection control right now because we're seeing more and more problems around the world with these infections that don't seem to have any reliable antibiotic that we can treat. So the more focused we are on limiting antibiotic use to the appropriate people, the less we develop these very resistant organisms.